Welcome to the Bibliobazar podcast. In this episode, Dr. Sam and RN Nina dive into the topic of fracture classification. This discussion is proudly sponsored by Nurse Unity Chats, connecting healthcare professionals for meaningful conversations. Let's get started.
So fractures, they're more than just broken bones, right?
Yeah.
There's a whole world behind how we classify them.
Absolutely. I always thought a fracture was just a fracture. What's the deal with all these types?
Well, it's fascinating. Fractures vary so much, and classifying them helps doctors communicate better and plan the right treatment.
Right, so you're saying the classification is like a universal language in medicine?
Exactly. It's like how musicians read sheet music to play the same song together.
That's a cool analogy. So, what are the main ways fractures are classified?
There are several. First off, by the fracture line appearance, you have transverse fractures, which are straight across, and oblique fractures that are diagonal.
Oh, and then there are spiral fractures too, caused by twisting forces?
Exactly, and they create this helical pattern in the bone. Comminuted fractures are another type, where the bone shatters into pieces, making it more complex to treat.
That sounds painful. What about greenstick fractures? I've heard kids get those more often.
Yeah, they do. It's where the bone bends and cracks on one side, much like how a green twig behaves when you try to break it.
Makes sense. And then there's classification based on skin involvement, right?
Yes. Closed fractures keep the skin intact, while open fractures break through the skin, increasing infection risk.
Open fractures must be tricky to manage with all that exposure.
They are. Infection control becomes a top priority alongside aligning the bone properly.
So how does the cause play into classification?
Well, fractures can be traumatic from injuries, pathological due to diseases like osteoporosis, or stress fractures from repetitive use.
So athletes are more prone to stress fractures?
Exactly. Runners, for instance, put repeated stress on their legs, which can lead to tiny cracks over time.
That's wild. And anatomical location matters too?
Definitely. We classify fractures as proximal, middle, or distal, depending on where they occur along the bone and whether they involve joints.
Intra-articular fractures involve joints and can cause long-term issues, right?
Yes, because they affect joint surfaces, leading to arthritis down the line if not properly managed.
So stability plays a role too?
It does. Stable fractures have bone ends that stay aligned, while unstable ones can shift, complicating healing.
That must influence the treatment approach, I imagine.
Absolutely. Treatment varies. Stable fractures might just need a cast, but unstable ones could require surgery.
Speaking of special types, what's an avulsion fracture?
That's when a fragment of bone is pulled off by a tendon or ligament, often during sudden, forceful movements. And
compression fractures occur in the spine?
Yes, particularly in conditions like osteoporosis, where vertebrae collapse under pressure, leading to height loss and back pain.
Epiphyseal fractures involve growth plates in kids, right?
Exactly. They can affect bone growth if not treated properly, which is why they're a big concern in pediatric orthopedics.
So how are fractures diagnosed? Just x-rays?
X-rays are the first step, but we also use CT scans for complex fractures and MRIs for soft tissue involvement. Bone
scans can detect stress fractures too, can't they?
Yes. They're sensitive and can pick up on tiny fractures that might not be visible on X-rays.
Treatment-wise, what's the range of options?
It ranges from non-surgical methods like casting and bracing to surgical interventions like internal fixation with screws and plates.
And bone grafting is for significant bone loss?
Exactly. It helps in cases where the bone needs extra support to heal properly or restore its original form.
What about complications? What should patients watch out for?
Complications can include delayed healing, or non-union where the bone doesn't heal at all, and malunion where it heals incorrectly.
Infection is a risk too, especially with open fractures?
Absolutely. Preventing infection is critical, and neurovascular damage is another concern if nerves or vessels are injured.
So prevention is key. How can people reduce fracture risks?
Maintaining good bone health through diet rich in calcium and vitamin D, regular exercise, and preventing falls are important steps.
For athletes, proper training and equipment help too, I bet.
Definitely. Gradual progression in training and using protective gear can reduce stress fractures and other injuries.
It's incredible how much there is to know about fractures.
I know, right? It's not just about putting on a cast, but understanding the intricacies to promote better healing.
You mentioned osteoporosis earlier. How big of a role does it play in fractures?
A significant one. Osteoporosis weakens bones, making them more susceptible to fractures even from minor falls or stresses.
So early detection and treatment of osteoporosis are crucial?
Absolutely. Medications, lifestyle changes, and monitoring can help prevent fractures and maintain bone density.
This has been really enlightening. I didn't realize how complex fracture management is.
It's a complex field, but understanding it helps us appreciate the importance of proper care.
Definitely.
And the amazing ability of our bodies to heal.
Well, thanks for breaking it down. No pun intended.
Ha! Anytime. Just trying to keep things in alignment and spread
Nice
some
one.
knowledge.